Because most of the time the people are not honest. They tend to come and cheat, and many people who are here from since 6, 7 o'clock in the morning standing up waiting long, other people come in and excusing themselves within the line.
Some of them are 6 feet apart and the others are jumbled up too much on one another. Each supermarket where I attend and even in the pharmacy, they're cooperating very well, and it's a good thing that they're doing. Very good.
I am very passionate about being here, performing my duties on the front line of COVID-19. Our job is not so easy, but we all know that someone has to do it.
It's not an easy job, it's not easy, very difficult, but however, country about self, and we managed to take on the task.
Prime Minister, you shall step up the police them money, because they out here in the hot sun to keeping the people them from fighting and shoving in the line. And what they do is a very, very good job.
Is on.
COVID-19 weekly briefing for Wednesday, the 7th of October 2020. I am Lesroy Williams. Thank you very much for joining us today for this briefing. I want to say a special welcome to an Omalje, who I understand somebody met me and said to me that he's a 9-year-old who does not miss any one of the briefings. And he's from Connery, so I think that is very admirable. He always asks, when is the briefing coming on? And he's always there to look at the briefings. I would invite Unicoma Courts, members from the Unicoma Courts, to make a presentation of PPE, personal protective equipment, for frontline workers. We have with us Trudy Allen, Edwina Moses, Melissa Keynes, and Vincia Matthew. They are going to make a presentation to the Ministry of Health, and I would invite Dr. Wilkinson to come and accept that donation from Unicoma Courts, and I invite Trudy Allen on behalf of the workers at courts to make the presentation.
Okay. Good afternoon, everyone. Unicoma is pleased to be able to donate personal protective equipment in the form of a Marbe Aero box to the Ministry of Health in St. Kitts. We are trying to do our part in the fight against COVID-19. That said, we would like to donate 4 or 5 PPEs to the ministry.
On behalf of the Ministry of Health and all of the frontline workers at the health institutions, particularly the anesthesiologists and the doctors and nurses who would be working closely with patients who are potentially infected with COVID-19. I want to say how grateful we are for these aero boxes. They might appear simple, but they are significant protective equipment that can protect the lives of the healthcare workers, in that when one is doing any intubation, where you're putting a tube into the person's lungs, and there's a risk of aerosols that are being generated that can be filled with COVID-19 particles. These boxes, if they're placed over the person's head while the anesthesiologist is working, it will tend to protect the persons who are in the close vicinity. So we thank you very much for these 5 pieces of equipment, and I assure you that they will be deployed in the emergency room on the private ward where the COVID-19 patients would be housed, and also in the ICU and even in the operating theater, because we never know, and we have to suspect that everyone is positive. So we thank you very much for this significant donation that would save the lives of our healthcare workers. I thank you. And,
Thank you very much, and we continue to thank those persons in the society who continue to donate to the Ministry of Health and its COVID-19 response here in the Federation. I would now invite Superintendent Cromwell Henry, Divisional Commander for District A, to present us with his report. Superintendent.
President, good afternoon all. Thank you, Mr. Williams. As we prepare for the opening of our borders, it is important for us to continue to think of all the ways we can prevent the spread of the virus. We have been highlighting the most common means of spread prevention over the last 7 to 8 months. These are the wearing of masks, sanitization, social and physical distancing. Today I will spend some time to speak on another non-pharmaceutical means that prevent the spread of the virus. That is quarantine. Yes, quarantine. You have been hearing of quarantine over the same period you have been hearing of the other measures. What is quarantine, though? Quarantine is a restriction on the movement of people, which is intended to prevent the spread of a disease. It is distinct from medical isolation, in which those confirmed to be infected with a communicable disease are isolated from the healthy population. Quarantine is a public health measure that is within the purview of the Chief Medical Officer, who determines whether one quarantines at home or at a designated site. The CMO is empowered under the Public Health Act and the Quarantine Act to set conditions of stay while a person is in quarantine. Section 15B of the Public Health Act provides for substantial penalties for failure to comply with these conditions. I would read what this section says. A person who refuses or omits to do any act which he or she is required to do by this act or regulations, or to carry out any order, instruction, or condition lawfully made or imposed by any officer or any person acting under the authority of the Act, commits an offense and is liable upon summary conviction to a fine not exceeding $10,000 or to imprisonment to a term not exceeding 6 months, or to both such fine and imprisonment. We therefore urge persons who are traveling to the Federation to familiarize ourselves with our requirements for quarantine and comply with these conditions. Thank you.
Thank you very much, Superintendent Henry. I now invite our Chief Medical Officer, Dr. Hazel Laws, to present us with the Health Emergency Operations Center report. Dr. Laws.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone. This afternoon, it's my task, as per usual, to share with you the situation report from the Health Emergency Operating Center. Okay. Go now. Go ahead. Okay, all right, and so in St. Kitts and Nevis, at present, we would have reported 19 cases, that's 19 confirmed cases, 18 recovered, and at present, we only have 1 active case, and the patient is stable and recovering nicely. Can I pause? Is it the correct presentation? Okay, all right. All right, in terms of the CARICOM member states, we have a report of 42,217 confirmed cases, 28,855 would have recovered, and 831 deaths were reported. This dashboard provides you an overview of the status of the COVID-19 outbreak in our neighboring islands. For example, in Montserrat, they would have reported 13 cases, Dominica, 31, St. Vincent and the Grenadines, 64, Barbados, 200, Bahamas, almost 4,700, in Trinidad and Tobago, almost 5,000 cases, and in Jamaica, over 7,000 cases. So this provides an overview of the pandemic in our neighboring CARICOM member states. In the United States of America, over 7 million confirmed cases, total deaths 210,000. Globally, 37 million confirmed cases internationally and over 1,039,000 deaths. That's the death toll globally. So the pandemic continues to progress. In St. Kitts and Nevis, we continue testing our nationals who would have returned from hotspots and any suspected cases. So to date, we would have tested 2,586 persons. Between April the 24th to present, 435 persons would have returned nationals would have returned to the Federation. Okay, so in quarantine, we had the 3rd batch of students at the Ross University School of Veterinary Medicine. They would have completed, I think, their 14 days of quarantine, and they are being discharged. Their tests have all returned negative, and today they are being, at present as we speak, they are being discharged from quarantine. So that's the 3rd batch of Ross University School of Veterinary Medicine students. If you were watching CNN over the past few days, we all know that the President of the United States of America was recently diagnosed with COVID-19. Ladies and gentlemen, the virus is far-reaching. It even reaches up to the top. And President Trump joins a number of world leaders who have been diagnosed with this virus. He spent 3 days at the Walter Reed National Military Medical Center. He was recently discharged, and if we were following, we realized that he was treated, with a number of drugs: dexamethasone, a steroid, remdesivir, and we heard about Regeneron's antibody cocktail. All right, so dexamethasone is a steroid medication that's commonly used. We use it every day in the treatment of patients at the hospital or in the hospital setting, and so this medication is readily available. The trials that are being conducted in terms of the use of steroids in the treatment of COVID-19, there are some preliminary data that tells us that steroids can improve the chances of survival for patients with COVID-19. It seems to be beneficial for patients with severe disease. Remdesivir is another therapeutic agent that is being studied in terms of its effectiveness in treating COVID-19. And again, the studies that are being conducted by Gilead, they tell us that remdesivir seems to shorten the time to recovery for patients with severe COVID-19 disease. All right, and so these are two of the drugs being utilized in the clinical management of patients with COVID-19. And then we heard about Regeneron's antibody cocktail on the weekend. Now, this cocktail therapy is made up of lab-engineered antibodies. So there is a monoclonal antibody that targets the spike protein of the SARS-CoV-2 virus. And then there is another antibody that targets a different part of the virus. And so this Regeneron coronavirus disease antibody cocktail, it reduces the viral load in the persons who receive the medication, and it helps to improve symptoms in non-hospitalized patients more quickly than the regular standard of care. And so it is promising, but please note that these are early results. And so Regeneron is publishing these early results because so far only a small number of patients have been tried with this medication. And so this data has not been peer reviewed as yet. But it's promising. So I just wanted to also this afternoon just recap, summarize the protocols that we will be employing when our borders reopen on the 31st of October. All right, and so just to reiterate that all travelers, inbound travelers to the Federation, you will be asked to log on to the national website prior to traveling, and you are to complete the entry forms, which will ask you for regular demographic information, immigration-related information, customs, and health questions. You also have to provide evidence of a negative COVID-19 PCR test done within 3 days or 72 hours of travel. And please note that this PCR test must be done at an accredited laboratory. All inbound travelers to the Federation will fall into two categories. And so we have the first category, meaning travelers coming in from the Caribbean bubble, any of the 7 Caribbean member states that constitute this bubble, and those coming from outside of the Caribbean bubble. In other words, those coming in from hotspots. And so if you're coming in from the Caribbean bubble, the bubble islands are Anguilla, Antigua and Barbuda, Barbados, Dominica, Grenada, Montserrat, St. Lucia, St. Vincent, and the Grenadines. All right, and so once you would have traveled directly from any of these territories to the Federation, let me just add, you would have had to be residing in a bubble territory for at least 21 days. And once you would have submitted a negative PCR test, upon arrival at the airport, you will be screened, And when I say screened, meaning your temperature will be taken and you will be asked health-related questions just to make sure you're not experiencing any of the COVID-19 symptoms. You'll be asked to upload the National COVID-19 mobile application on your phone, and you will be monitored via the app at least for the first 14 days. Once you are found asymptomatic, meaning without symptoms, you will be allowed free entry into the Federation without a period of confinement or quarantine. Now, and then you are free to stay at a regular private home or any of the non-branded hotel properties. Please note that all arriving passengers from within the Caribbean bubble, if you were, or if you have been in transit in a country or a territory outside of the CARICOM bubble, you will be categorized in the second category, which I will now go on to explain. All right, and so the second category involves inbound travelers, tourists, or returning nationals from outside of the CARICOM or Caribbean bubble. Now, if you are in this category, you will have a number of accommodation options open to you. All right, and so you can stay at one of the government designated facilities that are in vogue now as I speak. So that's the OTI or Royal St. Kitts Hotel in St. Kitts, the Oahu Beach Hotel or Portworx in Nevis. Or you can have your villa or your home assessed or evaluated by the task force, and once you meet the requirements, you can be approved or certified. Your home or your villa can be approved or certified as a potential site for quarantine or confinement. However, there is an attendant security facility, and the cost is borne by the applicant. And again, if you were to go onto our website, www.covid19.gov.kn, there is the pre-approved quarantine link on the site, and so you can just log on and complete your application, and it can be evaluated and assessed. And then your fourth option, you can stay at one of the franchise hotels. And so if you're in this category, you have a number of accommodation options open to you. And so the inbound traveler in this category will be required to submit a negative PCR test result done within 3 days of travel by an accredited laboratory. The traveler will be screened at the airport upon arrival, and as I said before, here the word screening means your temperature will be taken and you will be asked a number of health questions just to make sure or ensure that you are not experiencing any of the COVID-19 symptoms. You'll be requested to upload the SKN COVID-19 mobile application, and once you are not having or experiencing any symptoms, you will be allowed entry into the Federation, and you will be allowed to vacation in place at one of the accommodations I would have mentioned earlier. And if you would have chosen one of the franchise hotels, you will have access to an approved package of services within the first 14 days or for the duration of your stay if it is shorter. The international traveler will be required to do serial testing, and so on day 7 at your location your sample will be taken, it will be processed, and then on day 14 again you will be tested. If on day 7 if your PCR test returns negative, you have other options open to you. You can be allowed through the hotel's tour desk, and by appointment only, you can be allowed to access selective excursions or tourist destination sites on the island in a secure bubble. Okay, if your test on day 14 is negative, then you can be allowed to integrate into the society. Tourists in this category can only use or will only be allowed to use COVID-19 certified taxis or ground transport with appropriate petitions to move between the airport and your accommodation, the hotels, and to move between the hotel and the COVID-19 certified excursion and tourist sites on the islands. Phase 2. We've been getting questions regarding phase 2 of our reopening procedures. Now, the second phase will involve an expanded list of hotels and accommodations that will be certified to accept inbound travelers with significant risk from hotspots. The second phase will also involve an expanded list of excursions and local tourist destination sites that are COVID-19 certified with the relevant protocols. The second phase may also involve further changes to what we would have explained earlier. And this will be based on surveillance data that we will be collecting and the outcomes observed in the first phase. So, ladies and gentlemen, we cannot prevent a second wave of infections, even though our borders will be opened on October 31st. How can we do so? There are a number of measures that we can take, and it's very important that we get back into the habit of wearing our face masks when in public spaces. I think we have gotten a bit complacent in this regard, but that's going to help you to reduce your risk of exposure to this virus. All the stakeholders within in the front line at our borders and in the hotel and tourism sector, it's important for you to adhere to the infection prevention and control measures to ensure safety of yourselves, the frontline workers, safety of the people of the Federation, and safety of the traveler, tourists. It's important for us to always remember hand hygiene, good hand hygiene, and sanitation, especially in the school setting where you have a number of persons gathered for many hours, in the workplace setting, in the business place, and other high-risk settings like the prisons and nursing homes for our older adults. Ladies and gentlemen, physical distance is also very important. We need to maintain a minimum of 3.3 feet or 1 meter between persons when in public spaces. And we need to be responsible as individuals and collectively in avoiding crowds and gatherings of significant numbers of persons. When you look at CNN as to what's happened in the US, you realize that these functions are now deemed as super spreader events. And so if protocols are not adhered to, a simple function or social gathering or event can become a super spreader event. All right, and so we need to be responsible and only attend those that are absolutely essential, and be more selective in where you go and what you engage in as a means of reducing your risk of exposure to the virus. Dengue. All right, so this is far removed from COVID. However, it's very important. St. Vincent and the Grenadines, I think, they have reported a few cases of dengue, and I think there are a number of cases, about 4 or 5 cases that I've heard about in Antigua. And so dengue seems to be lurking around us again. And so as a federation, we need to be very careful in terms of how can we prevent an outbreak of dengue here at this time in the context of COVID-19. And so again, each and every one of us, we have a responsibility. What can you and I do to prevent an outbreak of dengue locally? And so it's important for us to be mindful of our immediate surroundings, meaning at home. Let's start at home and in our communities, in schools, and by extension, workplaces. We need to prevent mosquito breeding sites. Empty, clean, and dispose of containers that can hold water, because that's where the mosquitoes lay their eggs, and then the mosquito density increases. So we need to go walk around our homes and get rid of all those empty, dirty containers where water is stored. We are enjoying a period of good rainfall now, and so it's important for us to do so. Make sure our screens are intact, plug the holes, keep the mosquitoes out, use insect repellent where appropriate and when necessary, and dress appropriately when going out in the evening and at nights. And then we can opt to sleep under a mosquito net. These are some of the measures to ensure that we prevent an outbreak of dengue. Eliminate standing water. And so, if there's a puddle of water that you can control, I think we all have a responsibility to deal with it. Thank you.
Thank you very much, Dr. Laws. I now invite Mr. Abdius Samuel, who is chair of the COVID-19 National Task Force and the National Disaster Coordinator, to address us.
Pleasant good afternoon all, and thank you again for joining us for another briefing. And those of you who may be listening via radio, watching via television, or who have logged on via social media or virtually. Before I begin, just before I came up to the podium, I was checking our emergency management chat, and our colleagues from St. Lucia would have actually notified us in the chat about the present development in St. Lucia, and I wish to read for you. It says, on Wednesday, October 7, 2020, St. Lucia recorded a new case of COVID-19. The individual is a 29-year-old female national who arrived in St. Lucia on Sunday, September 27, 2020, from the United States. She was placed in a government quarantine on arrival. As per national protocol, she was retested on the 7th day in a government quarantine facility, and upon receipt of her test results was transferred to the respiratory hospital for care. It says that the communique further states that the Ministry of Health and Wellness has commenced the contact tracing and testing, which will be done on all persons who may have been in contact with this case. I said that to say to you the importance of quarantine, the importance of having a level of confinement or restriction of movement from persons who may be coming from potentially high-risk areas or countries. Hence the reason we keep every week appealing to the citizens, residents, and our visitors who are within our borders to continue to comply with the regulations. It's very important now more than ever as we count down to the reopening of our borders. My presentation today is going to be rather short. Again, we have 23 days, 6 hours, 50 minutes, and 16 seconds before we reach the 31st of October and the reopening of the borders, both air and sea. What has been the main objective of the National COVID-19 Task Force? It's simple: to reopen in a prudent way, taking every necessary precaution to protect the health and safety of our citizens, residents, and our visitors. And how can we do that? It's going to require the corridor of containment, which we spoke about earlier. How will that work? Simple. We're going to have the arrival of inbound passengers into our ports of entry. As they arrive into our ports of entry, they will be processed, and the process was already explained, whereby they will be screened. From screening, they will then move on to our border management agencies such as immigration and customs. Now, from there, it doesn't finish. It's one small element of the whole process. So as you come in, you are processed at our ports of entry, then you exit these ports, and then you have to go into the transportation aspect of it. And this transportation aspect is going to be very strict, whereby you will only be able to move on certified, again, on COVID certified transportation. COVID certified transportation for inbound international travelers. And that is very critical for you to note. Persons entering from the bubble would be allowed to move freely. So they can go into the rentals, or if the family can come and pick you up wherever the points of pickup may be, as the restructuring process is being done at the RLB International Airport. That will be possible. But inbound international travelers can only move in the COVID-19 certified transportation. So the next point I want to talk in the corridor of containment is the place of where you're going to vacation in place, or the place of quarantine. It's very critical. It's very critical, and the options were already given to you by the CMO. And I just read to you an excerpt from the release communique from the Ministry of Health and Wellness in St. Lucia. That is the importance. And at these facilities, at these government identified facilities that will be approved, there's high expectations that individuals who will be working there, the proprietors, must exercise the highest level of responsibility in ensuring that the protocols, the procedures, and the processes do not jeopardize, again, do not jeopardize their staff, do not jeopardize the visitors or the persons who are going to be occupying these properties. So these are the three critical things in terms of the corridor of containment for the period that is prescribed by the Chief Medical Officer and by extension the Ministry of Health. Now, it's going to require the all of society approach. And when we speak about all of society approach, we're talking about all of the government, all of the private sector, and most importantly, all of our citizens, residents, visitors, everybody who occupy our landmass here in St. Kitts and Nevis. I wish to appeal to you again to do our best to avoid a second lockdown. It's much harder than the first lockdown. We don't want to go through those long lines at supermarkets. We don't want to go through the many restrictions, because it's going to impact our mental, social, and also our economic status. It's critical that we do our best right now to ensure that we follow all the protocols that have been laid out by the regulations, and we have persons being compliant. Dr. Law said it clearly. We have dropped. You have seen persons lapsing in wearing the mask. And I want to appeal to the business places, because one of the things that I am seeing basically from the reports coming in is that one business place is doing everything to achieve compliance, but then another business or a competitor of the business is not doing what they're supposed to do, but they're still conducting business. So therefore, what are the customers doing? The customers are saying, well, you're being too stringent, and because of this, I am going somewhere else to shop or somewhere else to carry my business. So I am appealing to all the business places to standardize the means of operation as it regards to the COVID-19 pandemic, so that we could have the standardized approach across the board for everyone. It's important: hand hygiene, the marking, physical, social distancing, the wearing of the mask. No mask, no entry. Simple. It means that no mask, no entry. You don't have a mask, you come up to the counter, your products will not be cashed. So we need the standardized approach across the board from the businesses. This is not time for competitiveness between one another and jeopardizing the life of every citizen. It's about compliance. The compliance teams are going out on a daily basis, visiting these business places. However, the challenge is a lot of the business places are not being compliant, not even as simple as putting out markings outside to ensure there is a level of distancing, ensuring that the staff inside these businesses are wearing masks, ensuring that there are proper hygiene protocols being practiced on the inside, cleaning, sanitization programs, schedules. How often are we cleaning? Are we wiping our counters where we have number of persons accessing our services? It's very critical. We need to get this down packed before our borders open. Let us not be a reactive society, but rather a proactive society. I want to share with you calendar of events for the St. Kitts Mental Health Association, who are celebrating a week of activities that would have started on the 4th of October and will culminate on the 9th. And there is a great appeal to you to support them by wearing green, as they will have a Wear Green Day on the 9th of October. So on the 9th of October, I will be wearing my green shirt or polo shirt or whichever green I have to support the mental health. Mental health would have done a wonderful job during the lockdown period, providing support to individuals that would have gone in quarantine, to individuals who would have been infected by the virus, and as such, also in the recovery process, as we were coming out of these lockdowns, they provided many support, and we would have seen many presentations being done here at the COVID-19 briefings. So again, I am asking the citizens, residents, and visitors to support the calendar of events for the St. Kitts Mental Health Association, a critical partner to all of us in the Federation. And importantly so, I also seek support for the International Day for Disaster Risk Reduction, which is a week of activities that is being put on by the National Emergency Management Agency, NEMO, in collaboration with the Nevis Disaster Management Department. On the 11th of October, we will start with a church service, and on the 12th, we will have a launch of the NEMO staff video, where our staff will interact with you and explain the roles and functions. We will also have the launch of instructional videos giving you safety tips. And also we will have a radio trivia where you call into the radio station, and if you give the right answer, you will receive a gift. But most importantly, on the 12th, we will have what you call the Face of the Districts, where you will get to know who are the district managers, assistant managers, and the district volunteers within the various districts in St. Kitts and Nevis. On the 13th of October, which is the actual day, will be acknowledged internationally by all members of the UN, we will have an address by the co-chair of the Mitigation Council, the Honorable Wendy Colleen Phipps, and also we will continue with the face of the districts, and we will have a virtual open house. And the virtual open house, you will be able to log on Facebook and actually see what goes on at NEMO on a day-to-day, and we will have some various workstations from stakeholders where you will be able to see what they demonstrate. On the 14th of October, we will have another radio trivia. We will continue with the face of the districts, and we will continue with the instructional video. And the 15th of October, we will have the community outreach. We will continue with the face of the district. We will have in the night a very important event, which will be Family Feud. And I am inviting persons to log on, support, cheer for the district personnel who will be representing at this Family Feud. And an instructional video would also be launched on that day. We will culminate on the 16th with our staff development, and we will continue with the face of the youth ambassadors. Those are the volunteer arm of youths that are tasked with carrying out the message of comprehensive disaster management to our young citizens and residents. And the radio trivia will continue. The theme for this year is all about governance. Well, sorry, that's the hash mark. It's all about governance. And I must say that during the pandemic, one of the critical success factors that has helped us to gain successes is good governance. Good governance. And we can see around the world what bad governance during this time can do to a country. Correct, sorry? Next, please. We continue with the weather. Again, I am appealing to persons to continue to be prepared. We have been experiencing the passage of a number of tropical waves. Again, tropical waves with rain, thunderstorms, and lightning, which are conditions associated with these weather patterns. Weather is dynamic. So one time the forecast may say you may get 3 inches, you may end up with none. It doesn't mean that it was a bad thing. Okay? You need to actually stay alert and listen to the weather updates from the local authorities. They are centralized to St. Kitts and Nevis. That's very important. However, for now, the hurricane basin seems empty, and we want to continue to monitor until the end of November. When November 30th comes, then we can say, to God be the glory. Amen? So thank you for listening, and I do hope that we have reached you. And as we near to the opening of the borders, I am appealing to citizens to do their best. Again, do your best to support the efforts. You see, St. Lucia got that case. It doesn't mean St. Lucia got into a lockdown. What they had is a corridor of containment, and now they're going to manage and allow society to continue to move. That is critical. And St. Kitts and Nevis will be no less. And we as public servants, technicians, are going to do our best to assure you that we will not jeopardize or put into disrepute your safety and security. Thank you.
Thank you, Mr. Samuel. That brings us to the question and answer segment of our briefing, and I will start the ball rolling immediately. Question number 1. I was told of a patient who had her brain lining punctured from a swab during a COVID test, leading to fluid leaking from her nose. How common and serious is this complication? I was always of the opinion that this nose swab was a simple procedure with minimal risks. That's a medical question, of course. Dr. Cameron Wilkinson.
Thank you, Leslie. Yes, the nose swab is a relatively simple procedure once it is done correctly. And when the tester is taking the nose swab, they attempt to push the swab as far back in the nose as possible, traveling parallel to the roof of the mouth. It is not intended to go up towards what's called the cribriform plate in the nose. And yes, there was a case that was reported in the JAMA where a lady had a swab done, and sometime after she started to experience some lightheadedness, fever, dizziness, and some clear fluid running from the nose. But this was very rare. She was found to have what's called an encephalocele, which is part of the line of the brain that was protruding through the roof of the nose, and there was some damage because the swab was taken incorrectly. But I say this is very, very rare, and it's still very safe to have the nasal swab. However, if you had a history of nasal trauma, nasal bone fracture, if you were in an accident and you had a basal skull fracture, it is advisable that you have your swab taken from the mouth as opposed to in the nose.
Thank you, Dr. Wilkinson. The second question is from a Vaughan Radio for Dr. Laws. Given the expectancy of a second wave of the coronavirus, will there be any free or reduced cost in the price of testing for the general public when the Federation's borders reopen? Also, can you repeat the current charges for quarantine and for the PCR test?
All right, so thank you for your questions, for reading those questions, Mr. Williams. At present, the PCR test is done locally by a private lab, and the price is already subsidized. At present, the cost is it's US $100. So that's the cost, the present cost for the PCR test locally done by our private lab. But we would have shared, repeatedly on this program that the Ministry of Health has a molecular machine at the JNF General Hospital's lab, and so in the public sector, we are, strengthening our laboratory capacity, whereby this test will be offered publicly. All right, and so the cost of the test at the lab at the JNF may be less than the present rate, and so this will be announced when the lab, that aspect of the lab, is up and running. All right. Now, in terms of quarantine, I think there was a question with respect to quarantine. Okay, so at present, if you opt to go or stay at the OTI, it's US $500 for the 14-day period. All right, and if you opt for the Royal St. Kitts Hotel, you negotiate that price on your own with the reservation personnel at that hotel. So basically, that's a summary of the present rate. Thanks.
Our third question: what is this antibody cocktail that the famous President Trump received that he seems to have done so very well with? Dr. Laws.
All right, so the individual who is posing this question must have tuned in late to the program because one of my slides covered this. Regeneron, that's the name of the company that has produced the antibody cocktail that's been voiced in the news. So this antibody cocktail is made up of laboratory engineered antibodies that target special aspects of the SARS-CoV-2 virus. And in essence, what it does, it reduces the viral load and it improves the symptoms. And I suppose by extension shortens the course of the disease. And however, these results or this data is preliminary. The research work that's been done on this drug, the number of patients who have received it so far is still small, and so we have to wait and see what pertains when a more significant number of patients would have received this drug. And so the articles I've looked at says that we need to note that this data has not been peer-reviewed as yet.
It's interesting that the President of the United States has been used for experiments. The next question, why is there no quarantine for persons coming from the Caribbean bubble? Doesn't most of these islands in the bubble have more cases than us? Dr. Wilkinson.
Okay, two things. I think that the CMO explained that countries other than us, we characterize them into two groups, low risk and high risk. And the Caribbean bubble, all these countries are considered low risk. Yes, numerically, they might have more cases than us, but what we're looking at the number of cases per 100,000. And once they have less than 20 cases per 100,000 in the prior 2 weeks, they're considered low risk. That is the same risk as us. And so we are looking at the Caribbean bubble as just one region. The same way, for example, persons can travel freely from St. Kitts to Nevis because we have the same risk. The bubble extends to these other Caribbean countries. However, we have added an extra level of security by requiring negative tests 72 hours before they arrive. And so, yes, in opening the borders, there is going to be some risk involved, but we assume that the persons in the Caribbean bubble, we are all assuming the same risk because we have the same level per 100,000 relatively of COVID-19 cases.
This next question, when our borders reopen, are there any countries, states, where no flights will be allowed to come into the Federation? I think I heard some time ago that there will be no flights in the first instance from hotspots, such as Miami. Dr. Wilkinson.
I think we should have had somebody from tourism here, but as far as I know, we have flights that is pre-COVID coming from the United States, the UK, and the Caribbean. And when the borders are open, I guess sequentially we'll have these flights resuming, and from Canada. And once we have the protocols in place to identify, trace, quarantine, then it doesn't matter where the flight is coming from. And yes, there'll be flights coming from the US, I assume, once the borders are open, but we'll have the necessary things in place to mitigate the risk. And so I think that persons can rest assured that we should be able to pick up any persons who are coming in with positive disease. But of course, once the borders are open, we said that there's always a risk of the virus coming back here. And once we do the things that we have taught everyone that they need to do to protect themselves, we should be able to be safe. Thank you.
This next question, what will happen if I am coming from an island in the bubble, for example, Antigua, having been there for over 21 days and was seated next to someone coming from a hot spot in the USA? Do I still get to move around without quarantine, or will I have to be quarantined like the person coming from the hot spot? Dr. Wilkinson.
For the last 6 or 7 months, we've been preaching about how you can protect yourself, be safe, and the fact that eventually we're going to have to learn to live with COVID-19. And learning to live with COVID-19 means that you may come in close contact with somebody who has COVID-19, but once you're doing the things that you're supposed to do correctly, you should not catch COVID-19. So if you have your face mask, if you're hand sanitizing, etc., then you should be safe. And so just because one is traveling on the same plane with somebody who may have been infected, it doesn't necessarily mean that there's a 100% chance that you would have the disease. And so once you wear your mask when you're traveling, you properly sanitize, etc., and you try to see if you can stay as far away from persons. I assume that some of these flights initially there might be some degree of social distancing on the planes, and so that person should be safe. And so what you're comparing is somebody who is coming from a hotspot, who was there for an extended period of time, and somebody who is coming from the Caribbean bubble, who would have only spent 15, 20, an hour next to somebody who is potentially positive. And so the risk of you catching the virus during that short flight, if you were doing the necessary things to protect yourself, is very low. And so there should be no reason for us to quarantine that person. Thank you.
This question has to do with sugar mass. Trinidad has cancelled its carnival. Would you advise cancellation of our carnival in view of the fact that we can have significant spread of the virus with carnival in view and open borders? Sorry. I would like to hear Dr. Wilkinson's view on this, as I saw him in Juve last year and heard he's a regular, followed by Dr. Laws, who doesn't, to get a balanced opinion.
Well, let me address the Juve part first. I think it was last year, December the 26th, a friend of mine invited me downtown to exercise. I think his name was Ronnie Rascal. We went to school together. He gave me a shirt. I think there was something written on it called Extreme. And we went down there to exercise. To my surprise, a number of other persons showed up, and he had some music. We went around Bastia several times, and I went back home after several hours. If you call that Juve, what I consider was exercising after a heavy Christmas meal. And I would encourage everyone, once we get out of COVID-19 in the years to come, that is something that you should try to do to get rid of all of the calories you would have put on from all the food you ate Christmas. Now, as it relates to Carnival, yes, you said Trinidad cancelled Carnival, and you're asking if we should. Now, I think the chair of Carnival spoke on several programs already, and where we are starting is with a virtual platform. And so if you are thinking about Carnival in the way it used to be, now in the new norm, things are going to be different. And so I believe that we can start with a virtual Carnival where some of the shows will be virtual, and depending on the state of affairs in December, we can see how many other events can occur in person. But as we open our borders, we have to remember that we need to, number one, control what's called amplifying events, where you have crowded places, especially in enclosed places. And so things like massive crowds at fetes, stadiums, etc., those are things that are going to have a cap put on them if they are to occur at all. We also have to remember that we have to protect the vulnerable. And so you might be young and think that you can go to a fete and party yourself, etc., but you might be taking the virus home to your grandmother or mother who is in the high-risk category, that is being elderly with a pre-existing condition. And so that's one of the reasons why we continue to focus on educating persons so that they can do what is right, and we'll continue to isolate, test, identify persons who may have the disease. And so once we're doing these things, when the borders are open, we should be fine. So to again answer the question, I believe, yes, we can have a virtual carnival, and depending on the state of affairs, we increase things as things play out. I'll hear what Dr. Laws has to say. That was my opinion.
Mr. Williams, I think the person who posed the question, made some assumptions. I'm not sure wrong or right. They may not have seen me on the 26th of December. All right, but in terms of Carnival, I just want to go back to what I shared earlier. Our borders will be opened October the 31st, and we will be welcoming tourists, international travelers from hotspots, and it's hard for me to predict what's going to be, what the status of affairs will be in the island in December. And so for me, out of an abundance of precaution, we need to, and as I said earlier, we all have a responsibility to avoid crowds and mass gatherings, and that's the essence of Carnival. And so from where I sit, I do not foresee anything more than a virtual means of celebration, in terms of Carnival. And so I just want to put in a plug here. Once our borders open, there's an increased risk of the virus being reintroduced into the Federation, and we need to adhere to the measures. And one of the measures include physical distancing and social distancing, avoiding mass crowds, mass gatherings. And so I cannot contradict myself. Thank you.
Thank you, Dr. Laws and Dr. Wilkinson. There has been talks for many months about an app or tracker to monitor those who are entering the island. Is the government still considering using these? Dr. Laws.
And so in my presentation, I would have mentioned that incoming travelers will be asked to upload the national COVID-19 mobile application. And so, yes, that's the thinking. So the app is ready to be launched. What is being worked on is the legal framework for its implementation. And so we will utilize this tool to help us to monitor incoming travelers, both categories, that is, both from the travelers coming in from the Caribbean bubble and the higher risk traveler. So they will be monitored using this application. It has geofencing features whereby you'll be monitoring their location to ensure they are not outside of their where they ought to be. And then there is a clinical management aspect of it whereby the individual can communicate with the health authorities and indicate, hey, I'm having short of breath or difficulty breathing. And so, the relevant health personnel will be alerted and relevant and appropriate action taken in terms of the clinical management of such a case. And so, yes, we are very much thinking about utilizing the St. Kitts and Nevis COVID-19 mobile application.
And this is our last question for today, and it has to do with vitamin C. What is the role of vitamin C in fighting COVID-19? I am hearing of it being used. Can I also get it just from using my limes and oranges? Dr. Wilkinson.
Thank you. Okay, so vitamin C is known to have anti-inflammatory properties. It's an antioxidant, and it helps to mop up free radicals that are produced during infection, stress, trauma, etc. And it also acts as a cofactor in some of the hormones that are used to fight infection. And so it is thought that if somebody has an infection, if they're under stress, they would require extra amount of vitamin C. And this is extrapolated towards COVID-19, where it is thought that if you have extra vitamin C on board, it might help you through the inflammatory response that occurs when you have a severe COVID-19 infection. And so there have been some studies using vitamin C, and some persons have included it as part of their protocol in treating persons with COVID-19, but it is basically beneficial for anyone who has any sort of infection. And yes, you can get the adequate doses of vitamin C from eating your citrus, your oranges, etc. But in times of stress, you may need additional, and so that's why it can be given intravenously. Thank you.
Thank you to all of you who so ably answered those questions, and to the persons who posed them. I hope that you are satisfied with the responses. We have come to the end of our COVID-19 briefing for today. We thank Superintendent Cromwell Henry for his presentation, Dr. Laws and Dr. Wilkinson for their presentations, Mr. Abdias Samuel for his presentation as well. We thank Mrs. Christmas Jacobs for her service of sign language. We thank the media. We thank Ms. Vesta Southwell for her support at the NEOC. And of course, we continue to thank all those persons who donate to the Ministry of Health in its COVID-19 response. Thank you very much for joining us today for this briefing as we continue to update you on what is happening with respect to the COVID-19 pandemic here in the Federation and globally. Of course, it becomes more important now that you pay attention because of the opening of our borders and the adherence to the protocols which are so important. Thank you very much. We'll be back next week, Wednesday, for another briefing. Until then, I am Les Roy Williams.